We have a guest speaker from United States. His name is Mehdi Ansarinia. He is a board-certified neurologist with specialty training in headaches, with more than 25 years experience in diagnosis and treatment of headache patients. Tell us about refractory headaches.
Well, refractory headaches are headaches including migraines that don't respond to conventional therapies. And conventional therapies consist of medications and also, especially in the case of migraines, identifying and avoiding what triggers them. So with cases of refractory headaches, here patients are doing everything they can to identify and prevent their triggers from bringing on the migraines, but also are following their providers' directions in terms of taking their medications regularly, but they still have very frequent headaches, which at times can be disabling and problematic, interfering with their daily lives. Invariably, many of these patients undergo a variety of testings and see different specialists, and still no certain causes for the headaches can be identified, yet the patient continues to have headaches, which can be very problematic.
When should the patient visit a specialist if he has a refractory headache?
Well, that sort of depends on the patients. Typically, there's a series of treatment options, especially with the newer medications that have been out the past 5 years. And after trying these medications for a number of months, I would say, if the patients are not getting the adequate response and the headaches continue to be frequent, meaning more than 15 days per month or so, and the headaches are not responding to conventional therapies, then patients should see the specialist to help identify potential other causes for headaches that have not been discovered, and also to try different treatment options that have not been utilized before. So within a matter of months, I think, of starting therapies, if the headaches are not responding adequately, then patients should seek a specialist to get their headaches under control.
What is the role of the psychologist in the treatment of refractory headaches?
The psychologist's role is very critical because many of the refractory headaches cause different psychological comorbidities such as anxiety and depression, because the headaches are so frequent that those issues also come up and impact the patients in their life. Additionally, a variety of different refractory headaches can be exacerbated and triggered by stress, which the psychologist can be very vital in terms of identifying that and trying to address and treat it. Lastly, there's some treatment options in terms of relaxation of the muscles, which we may see with patients who clench their jaws and they have problems with neck pain, that the psychologist can be integral in terms of identifying those problems and trying to introduce solutions to resolve the neck pain and the tightness of the jaw muscles by cognitive and other types of therapies, including biofeedback.
Can you talk about a multidisciplinary approach to headache diagnosis and treatment?
Well, multidisciplinary approach involves utilizing a variety of different specialists that come together and all focused on identifying, diagnosing, and treatment of headaches in patients. It's by far the most effective way of addressing difficult and challenging headache and refractory cases, because many times these have multifactorial etiologies and you need different specialties such as psychologists, physical therapists, occupational therapists, along with the physician, to all integrate and form a team to approach the various problems that the headache patients can present.